So now I will be dealing with the clinical feature of Staphylococcus. So this is the most important function or feature of Staphylococcus. The first is your boil, formation of boil, furuncle. Okay. So what is important about this furuncle? They will lead to the formation of abscess, and at the same time, and the most important point for this abscess is they will have a one peculiar point. Okay. And around that point, there will be the fulfillment of pus, necrotic bodies. Okay. So if one boil is there, you call it as a boil or furuncle. If so many boil will present at the same point, they will lead to the formation of carbuncle. And this carbuncle, we call them as a cellulitis. So those who are surgery resident or those who have done the surgery ward and all, this is the most common case they will find. Okay. So this is, you seen them as a cellulitis. Okay. Fine. So there is another manifestation of this Staphylococcus, which we call them as an impetigo. Okay, this is below your mouth, and this is the crusty lesion. Okay. Now the another manifestation of Staphylococcus is your staphylococcal scalded skin syndrome in neonate, where there will be the peeling of the skin. Okay, and the most common toxin associated is your exfoliative toxin. Okay, look at this kid. Look at the exfoliation associated with them, the peeling of your skin of the neonate. Okay, so this was your 2018 in the NIT 2018 2021 INICET. They have been given you a picture of these uh, baby neonate, and they have asked the diagnosis and the causative agent. Okay, now, so the another manifestation is the mitral valve prolapse, or you can say the infective endocarditis. Okay, here what these valves are associated, and it leads to the prolapse of the valve. Okay, then the another manifestation is your osteomyelitis, the infection of the bone. Look at this MRI. Okay, this MRI is showing here, this is the big lesion where you will find this staphylococcus infection. In the ortho OPD ward, you will find so many cases of this osteomyelitis. Okay, wherever you are seeing a kid or child having pain, the femur pain or the back pain, you should suspect about the osteomyelitis. And very one important clinical feature of this osteomyelitis, when you are going to see the abscess will be like a ball. Okay. Now the other most common manifestation is your surgical wound infection. Okay, surgery have been there. Okay, they are not, the hospital or the hospital person is not taking care of those surgery site, or after the discharge of the patient, the patient is not taking proper rest, they are not taking the proper antibiotic, they are not following the post-surgical approach, there they can have these kind of infection. This is the pus oozing out from that skin. Okay, fine. So we have read all these manifestation of your staphylococcus clinical feature. These are the most common clinical feature you are going to get in your daily practice. Okay, so I will tell you about the pathogenesis, how they all begin. So look at this diagram. Okay, fine. This is the blue, the purple color is your staphylococcus infection. Okay, this is FNBP. They will attach to your fibronectin of, this is your epidermal cell. So they will attach to your cell on fibronectin with the help of FNBP, fibronectin binding protein. Okay, then so after attaching to this fibronectin of your epidermal cell, they will, what they will do, they will release toxins. Okay, they will release alpha toxin. So what this toxin will go, they will insert to these epidermal cells. So they will form a pore-like cavity. Okay, they will form a pore-like cavity, and after that the different staphylococcus will go inside the cell. Okay, once they are in the cell, they will release certain factors. They will release more toxins, they will release CLF, and with the help of these things, your polymorphs, yani neutrophils, will get attracted to your staphylococcus, and they will have inflammatory reactions, and then they will lead to the formation of pus, abscess, what I told you. One thing you need to understand, there are certain bacteria which will get rid of from your neutrophil, where the neutrophil can't kill them. So these bacteria will get access to your blood vessels and they will go inside the blood and they will cause bacteremia. Okay. Now, there is one more disease you have heard about when you are reading Staphylococcus, even in your final year, even in a gynae ops, or even in your second year examination. So you have heard about toxic shock syndrome. So there is toxin associated with this toxic shock syndrome, toxin 1. Okay, how they produce, why they produce. Now I will tell you. Look at this picture. Okay, so Staphylococcus are present in the vagina as a colonizer. Once the woman get this menstrual cycle, she uses tampon. So with the help of this tampon, this staphylococcus will proliferate. Okay, the staphylococcus will proliferate in very enormous manner. So they will release this toxin, and these toxin will get access to these blood vessels, and then they have a super antigen capacity. What the meaning of super antigen means? They do not require antigen presenting cells to present to the CD4 cells. They will directly link to the V beta region of your T cells, and then they release so many cytokines in comparison to the normal way. They release so many cytokines and leads to hypotension, shock like symptom. Okay. So now we are marching toward our diagnosis aspect. Clinical feature is completed. Okay, now let's start the diagnosis of Staphylococcus infection. So in the diagnosis, what we are doing, first we will do the gram stain of the samples. So in the gram stain, what you are going to have, what are the samples you will get? You will get the samples like pus. Okay. So in the gram stain, what you're going to see, look at these, the gram stain. The Staphylococcus aureus present as a grapes-like structure. That's why Staphylococcus. Coccus means circular, circle, and staph in the Greek means grapes. So grape-like structure. Staphylococcus will present like that. Okay. Then they are gram-positive cocci present in cluster. This is very important point. They are present in clusters. Okay. Now, what you will do? You will do the gram stain, and then the second important aspect is your culture. In the culture, which plate you are going to do the culture? Inoculation of the sample. The first plate is your blood agar, is the most important one. So in the blood agar, you will see beta hemolytic colony. Beta hemolysis means complete hemolysis of blood agar, your RBCs. So they will look like this: beta hemolysis, complete hemolysis. Okay. So there is one differential diagnosis of your staphylococcus. They also present as same in the microscope like your staphylococcus. Okay. So these are like your micrococcus. Okay. But the micrococcus, the colonies of micrococcus will not be as staphylococcus. They are not beta hemolytic. Okay. They will be yellow in color and there will be no beta hemolysis. But look at this. The colony of your Staphylococcus aureus is the beta hemolysis. Okay, fine. Then look at this plate. This is your nutrient agar. In the nutrient agar, the colonies of Staphylococcus will look like golden yellow. Okay, that's why we call them as a golden yellow colonies. Okay, this is quite your for your PG INI exam. So mostly we use blood agar for normal samples, okay, like pus and all this stuff. But there are certain areas where when they will grow in enormous amount, they can be very hectic for those personnel, like in your ICU ward. Maybe it will be AICU, adult ICU ward, or pediatric ICU ward. They will be hazardous for those patients who are admitted there, and they can cause hospital acquired infection. And when that person will get this infection, it is very dangerous to them. It can take their life also, because I told you what they can cause. They can cause pus, they can go inside the blood, and when they go in the blood, they can cause so many symptoms. Okay, fine. So that time you will we are going to do the sampling of your ward, ICU ward, AICU ward, PICU ward, to check for this. So in that ward, there could be so many commensals associated with your Staphylococcus aureus. So we need these selective media to so that our Staphylococcus aureus will only grow. Okay. So these selective media, there are certain selective media. This is your mannitol salt agar. In mannitol salt agar, the color of your Staphylococcus colony will be yellow. Just remember that. And the other one, like Staphylococcus epidermis, will be pink and all. We do not worry about the normal commensals. We are going to worry about this Staphylococcus aureus only. Okay. When okay. The most characteristic finding, whenever you are getting colony in the culture, after that you have to perform these catalase. Catalase is very diagnostic for your Staphylococcus differentiation. So what is catalase? Catalase is your H2O2. Okay, it is in the liquid form. When you will put these H2O2 drop on the glass slide, and after that, with the help of glass cover, you will take a pinch of the colony with the help of glass cover, and when you will put on these catalase, so they will produce these bubble like structure, and this bubble is showing that this is catalase positive, means we are going toward Staphylococcus species, and we are differentiating with the other gram positive cocci like Streptococcus pneumoniae, Streptococcus pyogenes, viridans streptococci, all these things. Okay. So this is catalase. I told you what is the function of catalase and how we perform this catalase. So most commonly we are doing with these glass slide, but at the same time we can do with these tube catalase also. But this tube catalase is not that much common in comparison to your glass slide. Okay. So these are the examples of those who are catalase negative. So look into the examples are here: Streptococcus, group B Streptococcus and group A Streptococcus. Then your Enterococcus, the Streptococcus pneumoniae, and the viridans streptococci. Means if the colony, the culture colony is catalase positive, means all these organisms which I told you will be eliminated. So now the second important differentiation. Now in the Staphylococcus aureus, in the Staphylococcus family, the most common and the most important Staphylococcus is Staphylococcus aureus, because it is very lethal. Okay. And there are other Staphylococcus also. We call them as a cons, coagulase negative Staphylococci. Okay. So now we know the sample is catalase positive, means it belongs to your Staphylococcus family. So we have to differentiate the proper Staphylococcus aureus from coagulase negative Staphylococcus aureus, like your Staphylococcus like Staphylococcus saprophyticus, okay, and Staphylococcus epidermidis, and all these stuff. Okay. So this is your coagulase test. Remember, The Coagulase test is the second most important for the differentiation of your Staphylococcus. Okay. And this is for your Staphylococcus species differentiation. Okay. This will help you to differentiate the species of Staphylococcus. Okay, fine. So this is your Coagulase test. So Coagulase test you can do with two aspects. First, on the glass slide, and second, in the tube. Okay. How you can do it? Slide coagulase and tube coagulase test. These are the two tests which is related to your coagulase. Okay. So this is used for your Staphylococcus specification. Okay. Which species it belongs to, whether it belongs to Staphylococcus aureus or they belongs to your coagulase negative Staphylococcus aureus, like your Staphylococcus epidermidis, Staphylococcus saprophyticus, Staphylococcus lugdunensis. Okay. So how we will perform this test? Okay. If we will take the slide coagulase, you have to take the slide. Okay. Then you have to take the suspension of your plasma, 1 drop of plasma suspension. Then with the help of cover slip, you have to take the colony, a very little colony, and you have to mix it with the 1 drop of your plasma. After mixing, the whole suspension will look like this curdy thing, turbid. Okay. Then if they belongs to Staphylococcus aureus, because there in the Staphylococcus aureus coagulase is present, and this coagulase will burst your plasma. Okay. So they will form this agglutinations. Okay. Then if you are using this in the tube, the whole function is quite different. There you have to take the bacterial suspension, and at the same time you have to take the plasma suspension. And the plasma suspension will be in the form of 1:5. Means one portion will be plasma and the 4 portion will be normal slime. Then 0.5 ml of that suspension you have to take, plasma suspension, and the 0.5 ml of bacterial suspension you will put in this test tube, and you have to left it for 4 to 5 hours. After 4 to 5 hours, this jelly like thing will be formed. Okay. And how you will check this? When you will tilt, if you will tilt these tube, this jelly will not move. Okay. So if it is sticky, it is sticked, it is not moving, means coagulase is positive and you are having Staphylococcus aureus infection in the sample. Okay, fine. So this is the chart of your slide coagulase and tube coagulase. Okay, slide coagulase, the principle is it detects the clumping factor, and the tube coagulase, it detects the extracellular coagulase. Okay. And this plasma, mostly it is the rabbit for theoretical aspect, but in most of the laboratory, we are using the normal plasma. Okay. So the important thing is for the slide coagulase, it is rapid. It takes only 10 to 20 seconds. But for tube coagulase, you have to wait for at least 1 to 4 hours. Then this agglutinins will form in the slide coagulase, and the precipitation is formed in the visible clot will be there in your tube coagulase. Okay. And more reliable is your tube coagulase and less reliable is your slide coagulase. Okay. Then these are the higher test. If you know the name, that's all. But for those who are doing microbiology, post graduation in microbiology, or those who are doing infectious disease, DM infectious disease, or any fellowship, for them this is most important. Now there are some other tests also. The test name is your DNase test. This is the plate having DNA agar. Okay. If you will inoculate Staphylococcus aureus, a ring like a clear halo will be formed. But for the other staphylococcus, this clear halo will not form. Okay. Then the second test is your phosphatase test. This is your phosphatase agar. In that, the pink colony of your staphylococcus will be formed. And how they function, I will tell you. But first, I will deal these DNase test. So what is the function of the DNase test? Okay. Now, the principle is you need to understand the Staphylococcus aureus produce DNase. They digest the DNA. So after digestion, what they form? They form the clear halo around the inoculation of Staphylococcus aureus. Okay. Now for what is the principle of phosphatase? Okay. This phosphatase, the Staphylococcus aureus, what they will do, they just hydrolyze phenolphthalein diphosphate medium. They hydrolyze the phenolphthalein diphosphate, and after hydrolyzation, they form phenolphthalein. When you will pass ammonia into these colonies will turn pink. Okay. So, which is more specific, which is more important is DNase. So, Staphylococcus aureus is exclusively positive for DNase test, but there are certain Staphylococcus aureus where these phosphatase test is also positive, like Staphylococcus epidermidis, Staphylococcus xylosus. That's why they are specific, but not more specific than your DNase test. Okay, so these two are your plates. Okay. Then now this is not for UG, those who are doing the second year. This segment is for those who are doing the specialty or super specialty, like DM infectious disease and MD in microbiology. So on the basis of gram stain, what we are getting? We are getting the gram positive cocci, and then you will do catalase. Okay, and catalase is also positive. Then there the DD is Staphylococcus aureus, and at the same time your DD is Micrococcus also. So there are certain tests where you will use it to differentiate Staphylococcus aureus versus Micrococcus. So what are the tests? First of all, the bacitracin disc. The Staphylococcus aureus is resistant to bacitracin, and Micrococcus is sensitive to bacitracin. Then the oxidative fermentative test. Staphylococcus aureus is fermentive and Micrococcus is oxidative. Then your fluoxamide test. Staphylococcus aureus is sensitive, Micrococcus is resistant. Then your lysostrophin test. Staphylococcus aureus is sensitive, Micrococcus is resistant. Then this is your lysostrophin test. So the whole suspension will be turbid. If you will put the colony of Staphylococcus aureus, they will just break the turbidity. They will break the lysostrophin, and then this whole suspension will become clear. So the Staphylococcus aureus will be clear solution. Then this is the procedure of lysostrophin. The bacterial suspension you have to produce. You have to add 0.2 ml of lysostrophin solution. Then you have to incubate for 35 to 37 degrees centigrade for 2 hours. Then this bacterial suspension containing Staphylococcus aureus will remove the turbidity and the whole solution will become clear. So this is your lysostrophin test. And second is your furazolidine test. So the Micrococcus is resistant to furazolidine and Staphylococcus is sensitive. So this is your disc. If you will put on the colonies of these Staphylococcus and Micrococcus, so this disc is resistant in Micrococcus, but they will show sensitivity in Staphylococcus. Okay, so remember that.